Hi everyone, this is Matt. We're continuing our series on interventional electrophysiology, and today we're going to do an overview of the various heart rhythm disturbances and other reasons that you would have an electrophysiology study done. So, essentially, the basic reasons for having an electrophysiology study done are the following. Your heart beats too slowly. Your heart beats too fast. Your heart does both of those. Your heart is at danger of stopping. And another is that your heart is not beating in an efficient way, maybe due to weakness from a heart attack or other causes. And there are studies that help to detail that with the potential of having an implantable device that will help to coordinate the beating of your heart. It's called CRT. So let's start with beating too slow. The pacemaker of the heart originates in most people the signal, the normal signal, that starts the heart contracting. The SA node, the sinoatrial node, I did a video on that earlier. You can review that in detail. Normally, it functions fine, but it can have problems due to medications. If you have too many of specific medications, that can slow the heart abnormally. And also, it can be due to congenital issues, that you simply are born with an SA node that doesn't function that well. It can have problems after you've had a heart attack. It can have problems because you have vascular disease in your heart. And it can also have problems because you have advanced age. So that can make the heart beat too slow. And there are interventions and ways to assess the reason that the heart is beating too slow. And the pacemaker of the heart, the SA node, is a focus for that. Another function of the heart or area that is important is the atrioventricular node. The AV node is between the atria and the ventricles. It too can have problems. For instance, in rapid AFib, it can conduct too many of the signals coming from the atria to the ventricle, which results in too many responses of the ventricle to what should be the function of the AV node to kind of ignore those abnormal impulses. So it can kind of fall down on the job that way. Also, in the other way, it can have problems in not conducting enough of the signals in a normal rate to the ventricles. That results in a block situation. And that is another functional analysis of the atrioventricular node that can be done during an interventional electrophysiology study. Then the ventricle can have its own problems. It can start throwing out extra beats, which are not being in response to signals coming from the pacemaker. They're just coming from the myocardium in the ventricle. This can be due to a heart attack. There are areas around the site of the heart attack that are at risk, and they can cause these abnormal signals from the ventricles to fire. Then there are the life-threatening rhythm disturbances in the ventricles, ventricular tachycardia with a rapid response that can cause your blood pressure to drop and put your life at risk, and ventricular fibrillation, which really causes the heart, the left ventricle, to be impaired and not be able to do the pumping function and get the blood out to the body. So these are kind of the basics of the heart rhythm problems, the heart rhythm disturbances. One is way too slow and or at risk of stopping. That's one category. One is way too fast and it causes circulatory problems. Then there is a category of patients who have had heart attack or infections, and they are at risk because of their weak heart to having sudden cardiac death. They're studied for potentially getting an internal defibrillator implanted. And the weakened heart and uncoordinated function of the heart, these people are studied with the potential of implanting a device that helps to coordinate the left side of the heart and the right side of the heart, such that you get a better pumping action and therefore better circulation to the body and improved quality of life for the patients. So that's the overview. We'll go into more detail about each of these specific heart rhythm problems: bradycardia, too slow a rhythm; tachycardia, too fast a rhythm; sudden cardiac death, CRT, and some other specialized areas where there are what they call accessory pathways. These are special conduction problems that some people are born with, and they need to also be studied and treated as well. Okay, and that's it for today. Have a great day.